Tuberculosis is an emerging infectious disease that claims the lives of about 210,000 people annually. TB can affect many areas of the body, but it is a primarily respiratory disease. The most common area that the disease affects is the lungs. TB is spread through airborne transmission. When an individual with this disease coughs, the bacteria is released into the air and then inhaled by an unsuspecting host. The bacteria then release pathogen-associated molecular patterns which are detected by the host's immune system. PAMPs are molecules like peptidoglycan that are within or secreted by pathogenic bacteria. These patterns are detected by the immune system, stimulating the immune response to get rid of them. Once the bacteria are detected, T helper cells produce inflammatory cytokines such as IL-1, IL-6, IL-17, and others which cause inflammation and recruit macrophages to fight the infection. Macrophages then engulf the bacteria in an attempt to destroy them. However, the bacteria have a way to avoid destruction. Mycobacterium tuberculosis can block the fusion of the phagosome with a lysosome, which prevents it from being destroyed. When the macrophage cannot destroy the bacteria because of the inhibition of lysosomal fusion, lymphocytes come together with the macrophage to form granulomas. These granulomas contain dead immune and TB cells, and the accumulation of these materials leads to damage wherever they are located. Granuloma formation is the cause of the coughing and bloody sputum seen in TB. There are two forms of TB: inactivated and activated. Inactivated TB is when the bacteria lay dormant within a granuloma for an extended period of time. This usually ends when the host's immune system begins to diminish. Activated TB is when the bacteria continue to grow and reproduce until the granuloma bursts and the bacteria goes on to infect other macrophages. New granulomas form and create more and more tissue damage until eventually, the host dies. Multi-drug resistant tuberculosis is when the bacteria develop resistance to the main drugs used to treat it. Resistance comes about in many ways, including mutations, sharing of R plasmids, and continued exposure to the same antibiotic. MDR-TB is one of the world's leaders in infectious disease death. This form of the disease is almost untreatable and usually requires a mixture of antibiotics. The drugs rifampin, isoniazid, and ethambutol are primarily used to treat TB and are taken over a 4 to 6 month period. When this isn't effective, furosemide is added to try to overwhelm and destroy the bacteria. While treatment of normal TB is usually successful, the treatment of MDR-TB is only about 40% successful and takes a massive toll on the patient's body. TB is an old disease that has become a new problem. The disease kills over 210,000 deaths a year. The disease invades the host immune system cells and uses the cell to reproduce in order to infect more cells. This leads to massive tissue damage. The disease is treated with many different antibiotics with varying levels of effectiveness. This disease claims the lives of many, and new research needs to be done in order to effectively combat the disease and help all people around the world.